8 out of every 10 people in the United States will be afflicted by hemorrhoids in their lifetime. In fact, over half the men and women over the age of 50 in this country currently have some form of symptomatic hemorrhoidal disease. It's a topic you rarely bring up among family and friends. Traditional treatment can be painful and intrusive. Patients are even reluctant to discuss hemorrhoids with their physicians. No surgery, no anesthesia, no banding, no stapling. HemWell is a non-surgical, highly effective alternative to traditional hemorrhoid therapy that is safe and pain-relieving. Place patient on table facing away from the provider with knees bent. Tear open probe kit. Place dry sponge in pad. Saturate pad thoroughly with 0.9% saline solution. Pad should be nearly dripping wet. Connect the cord to the pad, making sure the cord connects to the internal slot. Place the pad under the patient's hips with the cord connection exposed towards the provider. Coat anoscope with lubricant. Insert lubricated finger into patient's anus to relax sphincter muscle. Insert anoscope until tabs are flush with the patient, making sure that the cutout port is facing upward. Remove the obturator. A hemorrhoid, if present, will fall into the cutout port of the anoscope and be clearly visible. Document the grade and location of the hemorrhoid on the patient's chart. Replace the obturator and rotate the anoscope clockwise around the anal canal. Map the locations of any additional hemorrhoids. Grade the hemorrhoids 1 through 4. Choose the hemorrhoid to treat. Remove the probe from packing. Connect the probe to the handle. To allow both probe tips to make even contact with the hemorrhoid, the probe can be inserted either vertically or horizontally into the handle. This will allow the provider to establish a desired comfort level while holding the handle, depending on the location of the hemorrhoid. Test the machine by grounding the probe tip on the pad. Depress the timer key, located below the amperage bars on the right. Press the up arrow 2 times. 1 amperage bar will appear. Note, pressing the up arrow 2 times will increase the milliamps 1 bar at a time. The unit will not exceed 16 milliamps. Insert the probe through the anoscope and rest the probe as high on the proximal end of the hemorrhoid as possible and above the dentate line. Note, the probe should not penetrate the skin. Constantly ask the patient for feedback to access their comfort level. Slowly increase ampage while monitoring patient's comfort level. Note, time interval is based on the grade of the hemorrhoid and the amount of ampage delivered. Refer to operations manual. Foaming may appear at the probe tip, as well as blanching and color changes with an occasional volume loss. This is a unique biochemical reaction. While this foaming action is a visual indication that the process is working and is not critical to the destruction of the hemorrhoid. Remove probe after time limit has been reached. To continue, simply reset the handle. The timer will automatically reset to 0. When all of the hemorrhoids for that session have been treated, turn off the power on the handle, replace the obturator, remove anoscope. Note, chemical cauterization has occurred. Patients may feel some immediate symptomatic relief. However, the full effect of the treatment will be realized approximately 7 to 10 days after the treatment. Retreatments may be necessary for larger grades of hemorrhoids.